Hi, my name is Dr. Ari Isaacson, and maybe you're on the internet right now and you suffer from knee pain secondary to arthritis, and you're looking for a solution. You've tried all the standard things. You've had physical therapy, you've tried medication, you've done injections like steroids or Synvisc or PRP, but none of that is helping and you're looking for another solution. And you've happened upon something called GAE or Genicular Artery Embolization. Well, what is GAE? Well, first let's start with what is embolization. It's a big word, a medical term. What it is a very focused blocking of the blood for a therapeutic purpose. And what we're doing in this circumstance is we're taking a catheter about the width of a piece of spaghetti, we're inserting it into your artery, and we're manipulating it down the leg until we get to your knee. Then we shoot an angiogram. An angiogram is where we inject dye and we do x-ray at the same time, and we're gonna locate where are the centers of inflammation in your knee. Once we found those centers of inflammation, we're gonna insert an even tinier catheter through the first and focus right on those points of inflammation, and we're gonna cut off the blood supply to that inflammation. The result is that after a week or so, you're gonna start to feel relief from your knee pain. You're gonna be able to do a lot more things. And the great thing about this procedure is it doesn't hurt to do it. It's a painless procedure, and the effects can last years. It's really remarkable. It's a brand new procedure developed in the last few years, and it can really change people's lives. So if you want to find out more about GAE or Genicular Artery Embolization to treat pain from your arthritis in your knee, click on the website below and you'll be able to speak to either myself or another physician that works with us and discuss how GAE may be able to help you. Thanks, I'm Dr. Ari Isaacson.